Now, here's today's agenda. We're going to give you an overview of how Medicare works. First, we're going to talk about what your Medicare options are, and we're going to also walk you through a couple of real-life examples. And then we'll close out by explaining why it's important for you to review your Medicare coverage each year. But before we begin, let's think a little bit about our goals for today. If you could, please write down or think about the 3 most important things that you hope to learn from today's seminar. You can either submit them using the Q&A feature to help us ensure that we're covering what you would like to know, or you can just jot them down on a piece of paper for your own reference. And I'm going to give you a moment to think about or write down your particular goals. All right. Now, some things that you may be thinking about, some general things that may come to mind is, how does Medicare work? Or will Medicare cover all my needs? Maybe even a question about doctors. Do all doctors participate with Medicare coverage? These could be some of the questions that you have and what has brought you to our seminar today. Now, I'm going to turn things over to Jared and Lindsay as they help you understand your Medicare options. Let's get started.
Many people look forward to the day they become eligible for Medicare. With Medicare, you receive convenient and affordable health care that can help you stay healthy and active.
But choosing the right plan isn't easy. Medicare is complicated, and most people don't understand the material they receive from Medicare or insurance companies. In fact, a recent study found that 66% of insurers produce content that is more difficult to read than Moby Dick.
Today, we're going to help you make sense of Medicare. Choosing a Medicare plan that best meets your needs comes down to 3 key factors: cost, coverage, and care. When you consider cost, you should look at how much your plan will cost you in terms of both premiums and services, including prescription costs. Lowering your premiums or getting a cheaper price for even one expensive prescription drug can result in significant savings over the course of the year. When it comes to coverage, you want to know that the services you need and use are covered on your plan. Dental or vision coverage may be particularly important to you, for example. The care factor refers to being able to keep seeing your current trusted doctor.
Medicare covers different services in different ways. Let's start with the basics. There are 4 parts to Medicare. Part A, also known as hospital insurance, helps pay for inpatient hospital stays, skilled nursing facility care, home health care, and hospice care. Most people don't pay a premium for Part A thanks to those payroll taxes you've been paying your entire working life. Part B, or medical insurance, helps cover medically necessary services like doctor's visits and outpatient care. It also covers many preventative services, including screening tests and shots, as well as diagnostic tests, some therapies, and durable medical equipment like wheelchairs and walkers. Part B has a monthly premium that changes each year. Together, Part A and Part B are referred to as Original Medicare.
Part C, better known as Medicare Advantage, is another way to get your Medicare benefits. It combines Part A and Part B, and sometimes Part D, which we'll talk about in a second. Medicare Advantage plans are managed by private insurance companies approved by Medicare. Premiums vary by plan. Some are as low as $0. Part D is your prescription drug coverage. Enrolling in a Part D plan can save you money on your prescriptions and protect you against higher costs in the future.
There are 2 different ways to receive your Medicare benefits. On the left, you see the Original Medicare path. It's called Original Medicare because it's how Medicare started when it began in 1966. Original Medicare is composed of Part A and Part B. Because Original Medicare has gaps in coverage, many who have it purchase a separate MEDIGAP plan that covers those gaps, or costs. If you take this path, you must add a standalone Part D drug plan if you want coverage for your prescriptions.
On the right, you see the Medicare Advantage path. This is a completely different Medicare delivery system. Medicare Advantage plans include Part A and Part B benefits, and they most often also include Part D prescription coverage as well.
It's important to note that there is no limit to the costs you can incur with Original Medicare. Now, this means you are responsible for coinsurance and copayment costs, no matter how high they go.
That's why many people who take the original Medicare path buy MEDIGAP insurance, also known as Medicare Supplement Insurance. These plans are sold by private companies and help fill the gaps in original Medicare.
You pay a monthly premium for Medigap. These premiums can vary greatly even for the same exact plan, depending on your age, your location, the company selling the plan, and any discounts. You may pay less if you're a woman, a non-smoker, or married, for example. Some plans have low rates initially, but increase over time. People generally pay between $100 and $400 each month for a Medigap plan.
If you decide to enroll in a Medigap plan, it's best to do so when you're first eligible. After you turn 65 and enroll in Part B, you enter a 6-month Medigap open enrollment period, during which there is no underwriting. That means you can enroll without a medical review.
Now, enrolling after this 6-month period can cost you. You'll have to go through underwriting, and your premium can increase significantly based on your medical history. The company can even deny you coverage completely.
And remember, Medigap plans don't cover prescriptions. If you want a prescription drug coverage with a Medigap plan, you'll have to get a separate Part D prescription drug plan. This plan will have its own premium that you pay in addition to your Medigap premium and your Part B premium. In other words, you'll have 3 premiums to pay and 3 insurance cards to carry.
I hope you have a big wallet.
You can enroll in a Medigap plan at any time, but you can only enroll in a Part D prescription drug plan at certain times. This includes when you turn 65, during the annual enrollment period from October 15th to December 7th, and when you qualify for a special election period because you're moving into a new service area, leaving employer coverage, or eligible for a low income subsidy.
The other way you can receive your Medicare coverage is through Part C, Medicare Advantage plans. These plans are approved by CMS and are a part of the Medicare program, but they're offered by private insurance carriers. They include all Part A and B benefits and often include extra benefits like dental, hearing, or vision care. If you have a Medicare Advantage plan, there's an annual cap on your out-of-pocket expenses.
Most Medicare Advantage plans include prescription drug coverage. That means with a Medicare Advantage plan, you only pay 2 premiums, your Part B premium and your Medicare Advantage premium. Many Medicare Advantage plans offer low or $0 premiums, so you may even just pay 1 premium.
You might be wondering how Medicare Advantage plans can offer a $0 premium. Medicare pays these insurance companies to provide your medical and prescription coverage. In addition, the companies are able to negotiate good rates with medical and pharmacy providers, resulting in lower costs for you and better benefits. This is a big difference between Medicare Advantage plans and Original Medicare.
With Medicare Advantage, you get your care from a network of doctors and hospitals through either a health maintenance organization, or HMO, or preferred provider organization, or PPO. These providers all work together to take care of you. You're still in the Medicare program and you still have the same Medicare rights and protections. If your plan leaves Medicare, you can join another Medicare Advantage plan or return to Original Medicare.
You can pay copayments or coinsurance for medical services when you have Medicare Advantage. Unlike Original Medicare, however, there is an annual cap on these costs called the maximum out-of-pocket. This means your copayment and coinsurance costs have a limit, and once you reach this limit, the plan covers 100% of the costs of all your Medicare services. This limit can vary by plan, and it's a very important protection for you.
Before you enroll in a Medicare Advantage plan, you must enroll in both Part A and Part B. You also must live in the plan service area, and you must be a U.S. citizen or lawfully present in the U.S.
Like Part D, you can only enroll in a Medicare Advantage plan at certain times, including when you turn 65, during the annual enrollment period, or when you qualify for a special election period. If you are in a Medicare Advantage plan, you're allowed to switch plans from January 1st to March 31st.
Unlike Medigap, Medicare Advantage plans have no underwriting requirements. Now, that means you can enroll in a Medicare Advantage plan regardless of your health.
Let's sum up the differences between MEDIGAP and Medicare Advantage. When you pair a MEDIGAP plan with a Part D plan, you will have a significantly higher premium cost. However, the benefit is you have low or no out-of-pocket costs. Medicare Advantage plans generally include Part D and have a low or no premium, and you pay fixed copays for the services you use.
Medigap plans do not have a network of providers. With Medicare Advantage, you have an entire HMO or PPO network of doctors coordinating your care. As long as you ensure your doctor participates in your plan before you enroll, you should experience no disruption in care.
Finally, most Medigap plans do not include extra benefits. Medicare Advantage plans do. These may include dental, vision, and hearing benefits. Most plans also include a free membership to a fitness facility and home exercise kits to help you stay healthy. When you're deciding which Medicare path is right for you, it's important to consider which benefits you need and will use the most.
Now, at this point, I want to pause and answer a few questions from our Q&A. Let me take a look and see what we have. Here's a great question here. This question is coming from JA. I am 64 with full healthcare benefits. Okay. I will not retire for 2 years. What plan should I enroll in now? That's a really, really good question. First off, you are 64 years old, so you're not ready yet, unless you're disabled, to go into any Medicare type plan or get your full Medicare just yet. Now, when you turn 65, and at that point, if you still have your coverage with your employer, you would probably want to keep that coverage with your employer. Now, definitely you definitely should go and see one of our advisors and talk with them so that we can kind of look at what you have with your employer and what's available on Medicare. But usually people stick with their employer coverage. But based on what's comparable, based on what's economical, that could change at that point in time. Now, if you stick with your employer's coverage, then you should defer taking your Part B. Take your Part A, receive that from Medicare, but your Part B, you want to defer the Part B and not pay the Part B premium. The moment that you are deciding to leave your employer's insurance, at that time, then you would look at picking up your Part B and then also your Part D going forward. And there's some time limits in there that you have from the time that your plan ends with your employer, and when you should pick up your Part B and Part D and not have a penalty for late enrollment. Okay, but for you to go through all of those different timelines, definitely, please give us a call. One of our advisors can walk you through that whole path, and you can make a really, really educated decision at that time. Awesome question. Thank you. Very, very, very good. Now, let's go ahead and go back into the seminar, and Jared and Lindsay are going to go over some real life examples of how Medicare coverage works.
Choosing a Medicare plan is a personal decision that depends on your needs and your budget. The same plan won't work for everyone. Let's walk through 2 real-life examples so you can see how these plans work in the real world.
Judy is 72. She has a number of health challenges. She's an insulin-dependent diabetic who recently developed COPD, and she was in the hospital twice last year. She sees her primary doctor regularly, as well as several specialists. When Judy turned 65, she enrolled in a MEDIGAP plan and a standalone Part D prescription drug plan. She pays $225 a month for her MEDIGAP plan and $35 a month for her Part D plan. She has no out-of-pocket expenses for her medical services, but she pays copays for her prescription drugs. When you combine the Part B monthly premium of $144.60 that everyone pays with her Medigap premium of $225 and her Part D premium of $35, Judy pays $404.60 each month in premiums alone. Her total annual cost is $4,855.20.
James also is 72. He has high blood pressure and he had a heart attack 5 years ago. Last year, he had outpatient knee surgery, followed by therapy, and he sees his cardiologist on a regular basis. He takes his medications and exercises regularly. When he turned 65, James enrolled in a Medicare Advantage plan that includes prescription drug coverage and has a $0 premium. He's only paying the Part B premium of $144.60 a month, or $1,735.20 a year. James does have out-of-pocket costs. He doesn't pay anything to see his primary care physician, but he visited his specialist 4 times this year and paid $40 each time for a total of $160. He also had 10 physical therapy visits that cost $20 each for a total of $200, and he paid a $275 co-payment for his knee surgery and $25 for lab work. His total out-of-pocket costs were $660. Combined with his annual premium cost of $1,735.20, James' total annual costs were $2,395.20.
Judy and James are the same age, and they both have experienced significant health issues. But Judy paid $2,460 more for health care last year. The difference between what they paid is actually more than what James paid total. It can be hard to predict hospital visits and medical emergencies, and someone like Judy with chronic conditions may be better having a higher level of coverage. These examples demonstrate why each person should review their options carefully and look for the path that seems best suited for them.
Okay, let's take another look at what's in our Q&A and see if there's any other questions from the audience. Okay. We do have one question here, and it states, this is from Susan, and she's saying, how much would Judy have paid if she were on a Medicare Advantage plan? That's a really good question. And I can't really give you a precise answer to that, but because these plans, they do cost different. And these were for, just for illustration purposes only. But in the illustration, if Judy had been on a Medicare Advantage plan, she would have had some co-pays, she would have had co-insurance that she would have paid versus the Medigap plan that she was on. And with the way the illustration broke everything down, there was a $2,500 difference between the premium cost that Susan was paying and the total cost that James was paying. Now, here's the thing. If Susan had been in a Medicare Advantage plan, she would have had to use up a lot of services to reach that $2,500 in premium cost that she paid out. So in this particular example, even though we can't compare apples to apples and give a really precise answer to your question, just know this: the services that Judy had, she probably would not have used up $2,500 worth of premium costs to overshoot what she was already doing. And that's where you really have to deal with, how's your health care? What are you doing for your health care? What are the services that you're using right now? And then make a decision based on where your current health is as to which plan might be the better plan for you. Good question. All right, we're going to continue. Next, Jared and Lindsay are going to share how you can make sure that you are in the correct plan.
Just like you schedule an annual checkup with your doctor to ensure you're in good health, we encourage you to schedule an annual Medicare plan checkup with Advise to ensure you're in the right Medicare plan. We recommend you meet with a benefits advisor each fall during the annual enrollment period to review all your plan options for the following year.
There are a number of benefits of an annual Medicare plan checkup. First, Medicare changes each year. Costs change, regulations change, and plans change. These changes often translate into new or better benefits for you. Second, your personal health situation may change. You may need to start taking a new prescription that your current plan doesn't cover, or you may be diagnosed with a new medical condition that requires different coverage. Third, you may discover a new plan that offers better coverage for your existing medical conditions, or includes extra benefits that would make your life easier. Finally, switching to a new plan can save you hundreds of dollars annually. You may have unknowingly been overpaying for years. If you've never done a cost comparison of the different plans available to you, you may be surprised at the savings you find.
The best way to review all your options is to meet with a Medicare expert, like Advise. As you look at your options, consider the following questions. Which plans allow me to continue seeing my doctor? Which plans include prescription drug coverage? How do I get coverage for dental services and eye care? How much are plan premiums and payments?
Advise can provide you with a side-by-side comparison of all the plans that your doctor participates in to answer these questions. If we discover that the plan that you're currently in is in fact the best plan for you, great! We recommend that you stay in that plan. Now, if we find a plan that can lower your costs and offer better coverage, we can help you switch. We want you to feel confident about your coverage, whether you're making a change or not.
At Advise, you're at the center of everything we do. We partner with physicians and pharmacies to provide concierge-level service to their patients and customers. In other words, we aren't working for a specific insurance company. We're working with your doctor for you. And our services are always free to you.
Our goal is to simplify the Medicare experience for both patients and physicians, not just during the annual enrollment period, but year-round. In addition to providing side-by-side plan comparisons, we can answer questions about your Medicare benefits, including prescription costs, and help you understand your billing statements. And of course, we offer educational seminars on Medicare like the one we're hosting today.
Choosing the right Medicare plan isn't easy. We're here to help. To learn more about Advise or schedule your free consultation, please visit www.adviseinsurance.com.
I hope that the information today has been helpful. Our physician partners ask that their patients have a health plan checkup once a year, just to make sure that their plan is still meeting their healthcare needs. If you're wondering if a personal appointment is right, know that our advisors can have a quick look and then let you know right away if your plan is best. We've been able to find on average about $500 of savings for those who consult with us. Now, you can call us at the phone number that you see here on the screen, or please complete the form at www.adviseinsurance.com/contact me. This is if you have any questions about your plan or would like to schedule an appointment to discuss your options. And like I did earlier, we put a link in the chat box that you can click on to contact us to help you with your Medicare coverage. Now, before we leave, we would love to get your feedback. And this will be about today's seminar. I'm going to launch a poll that will open on your screen. And if you could, just take a moment to answer the questions and let us know if we've done a good job today. And then we will have our drawing for the gift card. You should see the poll opening on your screen right now. And while you answer the questions there, let me see who has won our gift card for today. Awesome, good. All right, looks as though we do have a winner. And the winner for today's gift card is J.A. And J.A., you are the lucky winner of a $10 Amazon gift card. Congratulations. Now, we will be sending your gift card via email in the next few days. And I would like to thank everybody for joining us today. I hope everyone has a great rest of your day. You've got some great information, and we look forward to speaking with you very, very soon. This concludes our Medicare seminar. Again, everyone have a great day, and we look forward to speaking with you. Goodbye.